Can you state your name, age, and gender and explain how your identity has influenced your experience in this profession?
My name is Kim Crosby. I am 60 years old as of September, and how is my identity? It has had no effect at all on my profession. Right now I'm a teacher. I'm also a physical therapist. I have not been practicing as a physical therapist for quite some time, but there were lots of guys and lots of girls in physical therapy. So yeah.
What is your current profession, and how would you describe the main responsibilities of your job?
Okay, right now I'm a sports medicine teacher. I still keep my physical therapy license current. So right now though, I'm not practicing physical therapy, but to keep my license current, I have to take a bunch of continuing ed courses and keep my CPR certification up to date. As far as working as a teacher here, I also have a credential that I have to keep up to date. So I'm actually doing two different professions right now as far as keeping things current.
Where does your work primarily take place, and why is that the best environment for what you do?
Okay, so right now I'm just working here at school. When I was a physical therapist, I worked in a private practice, and so it was an outpatient practice, and it was a great environment. You can work as a physical therapist in lots of different practices. You can work in the hospital, on the floors of rehab centers, skilled nursing facilities. There's all sorts of places. You can do home health. You can go to people's homes and do it. But when I was practicing, I just practiced as an outpatient physical therapist, private clinic.
What education, training, certifications, or licenses were required for you to enter this profession?
Okay, so when I was going to school, they required a master's degree, and then you had to pass your state boards. So it was basically 6 years of college after high school. Now it's a doctorate, so I think it's more like 7 or 8 years to become a physical therapist.
What influenced you to choose this career path?
My dad injured himself. So when I was at college, I started off in engineering, and because I always liked sciences and math. And while he was, but I never wanted to be an engineer.
Yeah.
But while I was at college, he was playing basketball with my brother and he messed up his hand. And he went to a physical therapist who specialized in hands, and he just thought, oh, Kim's gonna love this. And so he called me and said, you need to look into this. And then when I started doing the coursework for it, anatomy and things, I loved it.
Yeah,
so,
I really like it too. How does your profession relate to exercise science, sport performance, rehabilitation, or physical education?
Okay, so if you are working as a physical therapist and specializing with athletes, then yeah, there's a lot of exercise performance and stuff like that. Rehab, again, you're rehabbing athletes when they're injured, so you're helping them get over these injuries. So that's, of course, part of it. And even some physical therapy clinics are rehab clinics, so they're all on rehabbing, not necessarily just athletes, but they can be a person who has lost function and they need to regain that function, maybe from a stroke or a spinal cord injury, and they'll go to something called a rehab clinic that just tries to get them up to a functional level again.
Yeah. How long have you been in this profession?
So long that I can't even remember. I think I graduated mid-20s, and so counted up 35 years, a long time for PT.
What do you enjoy most about your job, and what are some challenges or aspects you dislike?
Okay, so I'll talk about PT. When I was practicing as a PT, I loved the fact that I was meeting new people all the time. So I would be, every day getting a new patient, or I'd still have some of those patients that I'd had for a while that I was seeing, but it was fun because you have different people that you're talking with all the time. So I liked that. I also loved when I could help them. So if they were having a problem and I got them better, it was great. The hardest parts, I didn't like doing the paperwork. You have to do it though. So you have to be on top of the paperwork all the time. So you have to do a lot of charting. And then the other thing is, if you had a patient that you couldn't get better, it was really frustrating,
Yeah.
you know, and that it was like, this is not a problem that I can help. You might need surgery or something else.
What is the typical salary range for someone in your position?
I just looked it up because I'm not currently working as a physical therapist. It's about $100,000 a year for California physical therapists.
What advice would you give to a student who is interested in pursuing a career in kinesiology?
Okay, so if you're going into any kind of a physical therapy type profession, you want to do really well on your science courses. You are going to have to take inorganic chemistry, organic chemistry. You're going to have to take a bunch of physics courses with labs, with the chemistry and the physics, probably kinesiology, anatomy.
Mm-hmm.
So I would just say focus heavily on your science, and then things will fall into place.
Yeah. That's great advice.